I'm Jennifer Stewart, Policy and Membership Development Officer at the Health and Social Care Alliance Scotland, and welcome to the latest episode in our Alliance Live series, Alliance Live 5. So today I'm very pleased to be joined by Louise Henderson, lecturer at Robert Gordon University within the nursing programme. Hi Louise, thank you so much for coming today. How are you?
Hi Jen, I'm good, thank you. Good to be here.
So I know that you're very passionate about involving people, involving communities in kind of co-production within health and social care, and you've recently completed a PhD research studentship, which was funded by NHS Grampian, if I'm right. And your study explored needs and relationships and experiences of health and social care from a kind of specific regional perspective. And so you've kindly came along today just to kind of dive into that. So I suppose just to begin, can you tell me a little bit about your research topic and why you kind of chose to explore that?
I came to the studentship with a background in district nursing. So I'd been in and around integration, or the concept of integration in health and social care for a number of years. And I was interested to know a bit more about relationships, experiences of integration, what that felt like, what it looked like for people who were accessing services. My supervisory team were involved in this as well, and that's Professor Katrina Kennedy, Dr. Heather Bain and Dr. Elaine Allen. So together we reviewed some of the literature, the evidence-based support health and well-being, or that explored, health and wellbeing needs of people who accessed health and social care, and how that influenced their experiences. But what was very clear from that review was that there was a definite need to know more about the experiences of people who were accessing the services and people who were also delivering the services too. So within this study, there were 7 cases in total. It was a multi-case study as such. So there were 7 different cases. There were 6 service users involved in that, 5 informal carers, and then 7 staff members across all of these 7 cases. It was in one regional area of Scotland, of which I can't be too specific on, obviously, to maintain confidentiality of our participants. But within that region, there were 2 health and social care partnerships that took part in the study. We collected the data between December 2019 and March 2020. And those the data were collected through interviews. So those either happen on a one-to-one basis, or often it would be in what we would call a dyad, where there were 2 people together. So it would maybe be a service user and an informal carer. And we used principles of interpretive thematic analysis. So we drew out themes that were recurring across the 7 different cases within the study to try and decipher what it was our participants were trying to tell us,
I mean, yeah, it's really clear that you're passionate about like truly meaningful co-production and a kind of participatory approach. So, you mentioned there the interview process, but could you kind of explain a little bit more then about how people who access services and deliver the services were directly involved within the whole kind of process of the study, from, I suppose, kind of inception to final outcomes?
Members of the public, people who used services, people who delivered services, and managers, leaders within those services and health and social care systems were all involved in sewing into this study in some way, and that was all the way through the whole research process. So they were involved in the initial planning, they were involved in the formulation of ideas and key concepts and defining those. When we talked about community, for example, what did that actually mean? They were also involved in developing the study design, so what that looked like. And when we talked about these 7 different cases that we had, they were involved in helping us to think about, well, what does a case look like? And furthermore, we involved members of the public and service users in interpreting the preliminary themes, and members of the public were involved in helping us to interpret that and refine our themes before they went into the final report. And equally, they were also involved in reviewing the final report.
So, I mean, you've spoken a lot there, Louise, about, I suppose, the process and the kind of methodology and like the kind of theory of practice, if you like. And I know that a lot of our listeners really engage with that, with how things are developed and how things are delivered, and are interested in that process. But I'm curious to know now, I suppose, you know, in conducting that, what were the outcomes?
For me, there were sort of 3 key points, you know, take home messages, if you like. The first one being that for all participant groups, so that was service users, informal carers, and staff member participants as well, interpersonal connections were a foundational principle of health and social care, and helped people to meet their health and well-being needs, regardless of which role they had. Participants talked about connecting with and understanding their own self, thinking about their changing role, and unfortunately, there were reports of sort of judgment and indiscriminate care that maybe wasn't quite as person-centred as it could have been. They talked about also connecting with individuals, so they might be connecting with people in communities, services, or health and social care systems. And when they made those connections, those led to supportive relationships, and they helped people, those supportive relationships help people to cope with their changing needs and indeed their changing roles within health and social care. And those supportive relationships also promoted collaboration between individuals, communities, services, and systems as well. And then to move on to the sort of second take-home message, when participants couldn't connect and build those relationships, they couldn't make those interpersonal connections with people who were supporting them across those different contexts, and they couldn't build those supportive relationships, they experienced isolation, loneliness, and they felt less supported. And the third and sort of final take-home message that I wanted to share today really was that health and social care didn't always meet the needs of the people who were accessing it or delivering it. And it wasn't just always person-centred as such, but there were some really good examples of where that was working well. Building supportive relationships positively influenced their experiences of health and social care, and that's the really good take-home message.
You talked there about the interpersonal connections, the kind of listening and honouring each person's story, and really that kind of healthy relationships produce healthy outcomes. But is there any examples? You spoke there about, you know, like good practice. Are you able to share any examples?
There's some really good examples in and around the importance of reassurance, and how staff members and informal carers recognised that service users had a need for reassurance, and they were able to meet that need in ways that were appropriate to the service user. And then there were other examples where the treatment or the care that people were accessing in the services, you know, it was appropriate to their needs, and they felt that it did tick their boxes, if you like. And one really great example of where that was happening was when service users and informal carers were connecting with people in the communities around them. And to my mind, when I was interpreting the findings, statutory services weren't always aware of the importance of the support that people were gaining from the communities that were around them. You know, and when I say communities, that could be defined as not only as local geographical communities, but they were defined as communities of people with a similar interest, for example. You know, so a group of community, you know, community workers, maybe volunteers who work together in an outdoor project, for example, or a men's shed, or a group of informal carers who got together to offer sort of peer support, if you like, in their caring roles.
Yeah, I totally agree. Community can be found in any way you want to define it, isn't it? But it's just so important that people are able to have something like that. So we're drawn to the end of our kind of chat today, Louise. I'm interested now to look at, I suppose, the impact of this piece of work. And so how do you see, the findings from this study kind of working to improve health and social care services for individuals, for communities, and I suppose as well for staff?
Better understanding the needs of the people who are accessing and delivering health and social care does actually help us to revise the way in which we, readdress the balance and the way in which we work together to meet the health and wellbeing needs of the people who are using those services. I feel that this study really puts people who use those services at the very centre of health and social care, and its development and its improvement as well, and ties in with those principles of co-production that you'd mentioned earlier as well. Inevitably, as we carry on in the ongoing COVID-19 pandemic, to my mind, there's value in taking this better understanding and using that to help us redesign post-COVID services and what those look like. And maybe we don't even need to wait till post-COVID. We can start that process now, in relation to revising the way that we deliver our services, and ultimately improving the experiences for the people who are using those services. For me, it's actually about promoting the importance of connections, those crucial supportive relationships, and how we can foster those and promote those across different communities, services, sectors and systems in health and social care.
Oh, thank you so much, Louise. Building connections, like you say, that doesn't have to wait. That's something that can be kind of applied today. Do you know what I mean? It's I understand that having a process and a kind of way forward and maybe a plan on an organizational level is useful, but on a person-to-person basis, that's something that can be put into practice. And thank you so much as well just for coming along today, Louise, and talking to me. For those interested in learning more about the study, we'll put information at the end of this video, so if you could just watch to the end, you'll find kind of links and more information about connecting with what Louise has spoken about today. So thank you for watching, and see you again. To find out more, you can email Louise at l.c.henderson2@rgu.ac.uk or Twitter at lou_henderson2.